Reflecting on the past 3 months I spent in Melbourne, I couldn't have wished for a more supportive team to work with, a more enriching city to be placed in, or a more inspiring project to be part of. My name is Anna DeWall, and I'll be returning for my final year at McGill in September 2019 to complete my Bachelor of Arts in Psychology with minors in microbiology and immunology and the social studies of medicine. As a first-generation immigrant of South African parents, I felt from a young age a particular responsibility to underserved communities in South Africa in a context of striking inequality. This commitment inspired my previous research in Cape Town on HIV epidemiology, where I worked on a study evaluating a point-of-care strategy for HIV self-testing. I have sought to improve equitable access to healthcare through research and work with NGOs in South Africa, India, Taiwan, and across Latin America. I knew I wanted to dedicate myself to empowering vulnerable communities, and my passion grew for changing the systems that perpetuate inequality. I was thrilled to receive the Queen Elizabeth Scholarship and be placed with the Impact Study. In an effort to work towards health equity, Impact is a 5-year partnership that takes place in 6 regions across Canada and Australia. The Victorian intervention aims to improve primary healthcare access for vulnerable populations in southeast Melbourne by connecting them to a general practitioner through a health service brokerage intervention. I've learned so much in my time at the Department of General Practice, from strengthening my skills in qualitative data analysis to gaining practical experience in cross-sectional study design. I'm very grateful to have worked with such a welcoming and engaging team whose constant support made me feel part of the life of the institution. I have developed a great appreciation for the potential of research interventions to translate into effective policy, closing gaps in health service delivery for those who need it most. An important experience was working with GP and patient interviews, where I heard stories of patients that came in with vulnerabilities such as mental and physical disabilities, domestic violence, drug and alcohol abuse, and then seeing the genuine care and compassion the GPs had towards changing their situations. A real strength of the QES program is its interdisciplinary nature. Being exposed to researchers and students from diverse backgrounds both in Melbourne and in our McGill cohort has been an incredible opportunity to inspire the exchange of ideas and foster networks ranging from clinical medicine to health management. In an increasingly globalized world, we need to seize opportunities to collaborate and come up with innovative solutions to our shared challenges now more than ever. During my time at the Department of General Practice, we marked the passing of Julian Hart, a UK family physician who proposed the inverse care law, that those with the greatest need paradoxically have the poorest ability to access healthcare services. Inextricably linked with access to healthcare is the notion of equity, which gives emphasis to its underpinning values of fairness and social justice. Looking to the future, I hope to continue my work in research and policies addressing the systemic injustices that disproportionately affect the vulnerable. I believe that we can all be agents of change at a grassroots level by taking steps in our communities that have ripple effects towards a more compassionate and humanitarian world.